what would you have, what would you have done if I'd hired you, if I'd known that I could hire you?
Good question. Yeah, I think, or definitely one of the things that you said was, push, encourage you and make sure that you're actually getting that biopsy. I love that you were persistent and you kept asking, even though people were saying, oh, it's just your anxiety. Unfortunately, some people, once they get one response with a, healthcare professional that says, oh, it's fine, they kind of just, don't feel comfortable asking again. The fact that you were persistent, I think, really helped save your life. And so a patient advocate like myself, I'd be, would push to help you get that diagnosis quicker, and making sure that as soon as it's done, we're getting those results, because I see over and over again that there's a lot of gaps in communication, a lot of errors with care. It's not, unfortunately, uncommon for cancer to be seen on pathology and the patient not notified for months, or the follow-up's not done for months later. I've called offices myself where I see pathology come up on like a portal and it's positive for cancer, and I say, hey, so I need to schedule an appointment for so-and-so, and the receptionist will tell me, oh, next appointment is in 6 months. And I'm like, oh, we can't do that. I don't think you understand. We need to be seen like ASAP. And, sometimes you get resistance. And then in that situation, I would be like, well, can you please pass it along to the doctor and have him call me back? And then, sure enough, we get an appointment the next day or something like that. But there's situations where, unfortunately, things like that happen. And if you're not used to what the normal is or what's the expectation, you kind of just take it for, the risk you get. And so a patient advocate, that's something that I would do in that situation. In addition, just really going over different options, different treatment options, helping find potential second opinions, or a right provider that will take care of you and will give you that right, the proper biopsy and care that you need. And also being with you along the way, because you never know what's going to happen, how you're going to feel. Do you need to get a different treatment? Having somebody there that's not related to you or not a friend that's really looking out from that medical best interest is great, because you want your friends and family to be there for you emotionally and support you and spend time with you. You don't want them to always be thinking about having to do the research and having to do this and making sure that the T's are crossed and things like that. So that's definitely a big area that patient advocate could help. Plus, with my medical knowledge and experience, I'm well versed in reading records, understanding what things mean, understanding when, pathology is good and it's not as good, and staging and things like that, and how fast things are, commonly occur and how likely things are to happen. So that helps as well.